Sleep hygiene is, in essence, a person's sleep habits. What they do during the daytime often affects how we sleep well at night. And it's an often overlooked section, but can very well play a significant role with regard to how a person sleeps. It's basics that we don't want to miss. Certain things that people do, such as drink a lot of caffeine. That's pretty common in today's society. And it helps us stay focused on the job, but unfortunately it makes it difficult for a person to get to sleep at night sometimes. And we don't always realize that a little coffee in the morning can last throughout the day and sometimes even prevent us from getting to sleep at night. Nicotine, that's very common in today's society as well too. That in my line of work as a pulmonologist, I see a lot of bad things that nicotine does, but it also has an effect on your sleep, makes it difficult for people to sleep, and then when they're not sleeping, or when the nicotine's coming out of their system at night, that also makes it difficult for a person to sleep. Alcohol can sometimes have an effect on a person's sleep. We know that a lot of people take a nightcap, a drink near bedtime in order to help them sleep, and it will help them fall asleep, but as the person's blood alcohol level is falling, that can lead to frequent awakenings, which paradoxically makes it difficult to sleep. So we recommend not having a drink within 4 to 6 hours of bedtime. Sometimes a person will feel very tired in the daytime, and that can result in a desire to take a nap. But unfortunately, even a very short nap can make it difficult for a person to fall asleep at night. And then sometimes a person's sleep environment can be a factor as well too. And that's obvious if you live next to a highway or under the landing pattern of an international airport, but there's other things, like sometimes the bed partner snoring can make it difficult for a person to sleep. Or the bed partner can have a TV on at all hours of the night. That can be a factor as well. Would recommend attempting to avoid these things. Go to bed only when a person's sleepy, because nothing is going to frustrate a person more than trying to go to bed when their body's not ready to sleep. And then getting up at the same time every morning helps set a person's internal clock. The half-awake brain is not the world's greatest problem solver. So, and this sounds a little hokey, but it does work. Is what's called worry time, and that is where you sit down after dinner, just get away from the hustle and bustle of the family, sit down after dinner and just clear your mind, write down what's troubling you, and then come up with some constructive solutions. Some people will take that piece of paper and fold it and put it by the bedside, and then if they wake up at 3 in the morning going, I've got to do this or that, then they can pull out, oh, okay, I came up with that solution. It's a lot better. And I used to teach the insomnia course, and I recommended that to some of my residents, and I saw some eyes get rolled, but when they used it on their patients, they said it really does work. Those are just some recommendations on sleep hygiene.